peripheral nervous system gathers and sends information from our environment to the central nervous system and then demands for action from the nervous system to extend back to the sense organs. There are three parts of the peripheral nervous system: the cranial nerves, the spinal nerves, and the autonomic system. For the purposes of this lecture, we're really going to focus more on cranial nerves, but I'll also mention the spinal and autonomic system. Here in the picture to the right, you'll see the highlighted cranial nerves. So these are really the nerves that are extending the face and the neck, and then this nerve here is a very specific nerve we'll talk about in a while. This is the wandering nerve, and it's the only nerve that really extends past the neck. So the spinal nerves are attached to the spinal cord and provide signals to the small and large muscles throughout the body. So these are the muscles of the neck, shoulders, arms, hands, legs, feet, torso, really all of that. So it's again the same role as the cranial nerves, just gathering information from the environment, sending signals from the central nervous system to change the motor movements of the hands, the feet, the legs, the arms, things like that. In terms of communication, it really has a role in writing and breathing. So it's going to help expand the rib cage so that we can bring air in during respiration, and then it also helps with moving the arm and the hands for writing. It can also help with movement for gestures in our nonverbal language. The autonomic nervous system controls and regulates the internal environment. So it has two divisions, the sympathetic and the parasympathetic system. The sympathetic system is really our fight or flight, so it helps in cases of emergencies where it's accelerating our heart rate, raising the blood pressure, dilating the pupils, and increasing the blood flow. And then in contrast, the parasympathetic really slows everything down and says it's okay, we have to get back to normal. So it's going to slow the heart rate down, lower the blood pressure, increase the activity in the stomach for digestion, and relaxes the body. These two systems are working at all times, but essentially they're working opposite of each other. So one of them might overarch one while the other is really trying to bring us back to our more natural state. So if you think about the autonomic nervous system affecting language and speech, you might say, oh, well, what's the heart rate really have to do? What's the blood pressure have to do? But think about the last time you talked in front of a large crowd. How did you feel? Did your hands start to shake? Did your voice get a little trembly? Did you start stuttering over words? That's really part of the autonomic nervous system, getting that blood pressure up, making us a little bit nervous, anxious, excited, and it's going to change our verbal output, our gestures, our articulation. So it's not specifically directed at language or cognition or swallowing, but it can affect those areas just because our body is in that fight or flight mode. So it's really paying attention to getting us out of that situation as quickly as possible and changing the way that we interact. Now the cranial nerves are located in the area of the brainstem, so they enter and exit at the base of the skull at the area of the brainstem. So remember, we have the midbrain, the pons, and the medulla, and each of those areas have corresponding cranial nerves that enter and exit. So these cranial nerves go through the brainstem to go through the appropriate areas of the brain. So there are 12 cranial nerve pairs, and by pairs that just means that we have a nerve for each side of the body, and the pair gives us the innervation for both sides of the body. And they connect to the sense organs or the muscles of the head and neck. So here we have the 12 cranial nerves, and you see we have olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, acoustic, glossopharyngeal, vagus, accessory, and hypoglossal. We're really only going to focus on 7 of these in terms of communication and swallowing and hearing, but it is good to go ahead and get a good list of these nerves going now, because this list is only going to grow as you go through your anatomy courses for communication disorders or in your future anatomy classes. There are different mnemonics out there for remembering the cranial nerves as well as the functions of cranial nerves, and so I recommend that you go ahead and start on that now, even though we're just going to learn the 7 of them, so that you can get used to associating them with their different types of innervations. So this is one that helps me. This is the face of the cranial nerves, and it kind of helps give you an idea of where the cranial nerves connect to as well as what their role is. So here we have cranial nerve 1. This is the olfactory nerve. This is the nose of the face. So the olfactory nerve has to do with smell. Number 2 is the eye of the face. It's the optic nerve, and it is responsible for sight. So it's a sensory nerve as well as cranial nerve 1. Then cranial nerve 3 is the eyebrows. It's going to help with movements of the eyes, so looking up and down. Then we have cranial nerve 4, which is towards the center of the face. This is also an eye movement nerve. This is the trochlear nerve. We have cranial nerve 5, which is this very large nerve that extends across the span of the face, and it is the trigeminal nerve. So it's giving us our sensation of the face, as well as some movements of the ears and things like that. And then we have the abducens, which is cranial nerve 6. This again has to do with movements of the eyes. We have the facial nerve, which is cranial nerve 7, and that extends, it gives us the sides of the face. We have the acoustic, and the acoustic is interchangeable with the vestibular cochlear nerve, or we'll just go with vestibular cochlear. That's what I'm going to use in our lectures. So this is for our hearing imbalance. This is a sensory nerve. So it's not the sensations of the ears. It is the sensations of our movement of our head in space, and for hearing, not for the feeling of the ears. The feeling of the ears is actually associated with cranial nerve 7. Then we have cranial nerve 9, which is for the back 1/3 of the tongue. Okay, and that's the glossopharyngeal nerve. So another term for tongue is glossus. And so you can remember the cranial nerve 9 is in the back of the tongue because it's the glossus and the pharynx nerve. So it attaches to the tongue and the back of the throat. And we have the vagus nerve, which is cranial nerve 10, and that's our wandering nerve. So this isn't really a great representation of the vagus nerve, except to say that it does have some role in taste and sensation of the tongue, but this nerve really does wander down to the digestive system and comes back up. So it's going to have a role in the larynx, the pharynx, the velum, and areas like that. Then we have the accessory nerve. You can remember the accessory nerve because it's where we put our accessories, right? We wear necklaces on our neck. And so the cranial nerve 11 helps with motor innervation of the shoulders and turning the head left and right. And then we have the hypoglossal nerve. So again, we have glossal. So this is on the tongue, and this is the anterior or front 2/3 of the tongue, and it's helpful for movement of the front 2/3 of the tongue. So this is breaking it down into just the 7 that we're going to focus on for this class. And I want you to keep in mind that these are just the overarching roles of these nerves. We're really going to break it down when we get into our future lectures for articulation and voicing and resonation and swallowing. But for now, it's just familiarizing you with the terms. So we have cranial nerve 5, the trigeminal, that innervates the face and the jaw, and it is the sensory and motor nerve. Then we have the facial nerve, cranial nerve 7, that innervates the tongue and the face as well. But remember, it's really going to be more of those sides of the face, where the cranial nerve 5 is going to be kind of the cheeks and the forehead. Cranial nerve 8 is the vestibular acoustic or vestibular cochlear or auditory nerve. This class we're really going to focus more on vestibular cochlear, and that's for hearing imbalance, again, not for the sensation of the ears themselves. That's related to cranial nerve 7. Then we have cranial nerve 9, the glossopharyngeal, that, as you've already learned, innervates the tongue and the pharynx, and it does motor and sensory components. And it's really more of a sensory nerve. It only has one muscle that it innervates for movement in the pharynx. So really I want you to know that it does both, but I'm not going to ask specifics in terms of the motor components. And then the vagus nerve controls motor and sensory innervation of the larynx, the respiratory muscles, the cardiac or heart muscles, and the gastrointestinal tract. So it is our wandering nerve. It's a very long and expansive nerve. We have the accessory nerve, that is a motor innervation for the shoulder, arm, and throat, and the hypoglossal, which really controls the tongue movements in that anterior or front 2/3 of the tongue. So some examples of what these nerves do is the trigeminal nerve is really for biting and chewing. So it's helping opening and closing the jaw. It's also, when we're speaking, opening and closing the jaw in coordination with our speech. The facial nerve helps with the taste in the front 2/3 of the tongue. It also helps with closure of the lips to keep food in the mouth. And as we're speaking, we're creating sounds with our lips, so rounding the lips, stretching them wide for things like when we say the letter E or cheese, we're getting that lip rounding followed by expanding the lips. Or if I say ma 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 ma, I'm using my facial nerve to open and close my mouth. Cranial nerve 9, or the glossopharyngeal nerve, helps with the sensation of the tongue. It also has taste in the back 1/3 of the tongue. And then again, it has that one muscle that it innervates for movement. The vagus nerve is going to help with closure of the airway, so protection during swallowing. It's going to help close the muscles of the pharynx. It helps lift and close the velum for resonation. It helps sensation of the larynx to know if any food or liquid is going into the airway. And it helps coordinate our breathing and our digestion. The hypoglossal nerve is really for the motor functioning and positioning that food on the teeth. So it works with the trigeminal nerve with chewing. So it's pushing that food onto the teeth, and as we move our tongue to push the food onto the teeth to chew it, we're opening and closing the jaw with the trigeminal nerve. So this is another one of those circumstances where we have little pieces and parts that are going to work together to give us our communication abilities. I know that the anatomy lectures tend to be a little bit dense, so we're breaking it down into little parts now so we can add to them later.